Warning: this resource is for educational purposes only. It may contain content that is culturally sensitive as it relates to women's cancers and men's cancers, which might not normally be used in public or community contexts. Cancer Council WA acknowledges and respects these cultural sensitivities and asks users to respect cultural protocols when playing this DVD.
What is cancer? Each day in Australia, around 2 Aboriginal and Torres Strait Islander people are told they have cancer. So it is likely you know of someone who has or has had cancer. But sadly, many of us still don't know what cancer is and how to prevent it. Some people have heard things about cancer that aren't true, like it can be caught from someone with the disease, it's a death sentence, it's a curse, it's payback, or it's punishment for doing something wrong. None of these are true. Cancer is not just one disease. There are more than 100 different types of cancer. They are usually named after a place in the body where they start to grow, and they start off from just one damaged cell. You may be familiar with some, particularly common ones such as lung cancer, bowel cancer, skin cancer, and breast cancer. The body is made of trillions of tiny cells. Normally, when a cell becomes old, worn out or damaged, it is killed off by the body and replaced with a new, healthy cell. Sometimes things go wrong and the body can't kill a damaged cell. This cell then produces copies of itself and grows out of control, forming a group of damaged cells called a tumour. This is cancer. The cancer can spread to other parts of the body through our blood. A tiny cancer cell can travel through the blood from one part of the body to another, where it can continue to grow. This cancer stops parts of the body from doing what they're supposed to do, and that is why cancer can be dangerous. Risk factors and prevention. There are a number of things that can damage cells and increase a person's chance of getting cancer. We call these risk factors. Some risk factors can't be changed, like your age. Other things can be changed though, like smoking cigarettes, drinking alcohol, not exercising, drinking sugary drinks, eating junk food, and not being sun smart. These are called lifestyle factors. 1 in 3 cases of cancer can be prevented with a healthy lifestyle. By not smoking cigarettes, exercising daily, keeping a healthy body weight, eating healthy foods, including bush tucker, protecting yourself in the sun, and avoiding or limiting the amount of alcohol you drink, you can reduce your risk of developing cancer. We also know that some infections increase the chances of developing some cancers. Hepatitis B is a viral infection that can cause liver cancer, and the human papillomavirus or HPV causes a few cancers. One of them is cervical cancer. Having the immunisation needles for these 2 viruses will decrease your chances of developing these cancers. Encouraging our family and friends to get their children vaccinated will help too. Screening. Taking part in screening programs before you feel sick or notice any unusual changes to your body can mean better chances of surviving the cancer, especially if it's found early. Screening does not diagnose cancer. It finds people who need more tests to see if cancer is present, so the cancer can be treated. There are 3 national screening programs in Australia that screen for cervical cancer in women over 25, breast cancer in women over 40, bowel cancer in women over 50.
And bowel cancer in men over 50. Don't wait until it's too late. Take part if you're invited. Men over 50 can also talk to their doctor to see if they should be tested for prostate cancer. Finding cancer early. Finding cancer early by talking to your doctor, clinic nurse or health worker about any unusual changes to your body can also increase the chances of successful treatment. This means knowing your body and telling them if you've noticed a cough that won't go away or you've coughed up blood, blood in your poo or your wee, unexplained weight loss, an unusual pain, lump or swelling, being out of breath more often, changes in a spot on your skin, or any other change in your body that is not normal for you. Having one or more of these symptoms does not always mean you have cancer, but it's a good idea to get checked out just in case. If you notice any of these changes or a screening test comes back positive, your doctor can organise some tests to see if you have cancer. Treatment and support. If cancer is found, treatment will depend on the types of cancer and whether it has spread to other parts of the body. The types of treatment include surgery to remove the cancer, radiation therapy which directs doses of radiation at the tumour to kill the cancer cells, chemotherapy which is strong medicine used to attack the cancer cells, and immunotherapy which helps the body's immune system work better at finding and destroying cancer cells. In some cases, more than one type of treatment is used. Cancer Council WA provides a range of support services for our mob that have been diagnosed with cancer, including counselling and support groups for emotional support, financial and practical support, and healthy living programs such as yoga, meditation and exercise classes. Accommodation is also available for patients and families when they need to travel from regional areas to have treatment. Summary. It's important to remember cancer is a disease of the cells in the body. While a small proportion of families have a higher chance of getting cancer, 1 in 3 cases of cancer can be prevented by having a healthy lifestyle. This means not smoking cigarettes, exercising daily, keeping a healthy body weight, eating healthy foods including bush tucker, protecting yourself from the sun, and avoiding or limiting the amount of alcohol you drink. You can improve your chances of being around longer for your family by taking part in cancer screening and vaccination programs and telling your doctor or health worker if you notice any unusual changes to your body or if you are worried something might be wrong. Many cancers respond very well to treatment if found early.
For more information, speak to one of our nurses at Cancer Council WA on 13 11 20 or visit www.cancerwa.asn.au. This video is proudly supported by Cancer Council Western Australia, Australian Health Promotion Association and Healthway.